Azubuike. Yes, he has so many bits of title to his name. But I'll drop that a little bit. He is the medical director of Federal Medical Center, FMC, Asaba. It's nice to have you join us, sir.
You're welcome. Thank you.
Thank you.
Good morning, viewers.
Good morning, sir. You just heard my colleague talk about the first wave of COVID-19 and the impact it had in the entire country and the world in general. Tell us more about the second wave. What does it entail in the medical field?
What is that?
Thank you very much. The second wave of the COVID-19 pandemic, like the first wave we had, came with a lot of illness, some deaths, lots of recovery. And then in most pandemics, like the one we had previously, many of us did not witness that. Usually when you have a first wave, there's this aggression, it's aggressively managed and all that, and then with time people relax. Oh, it's coming and there's jubilation, and we lose guard.
That's true.
Everybody forget about the protocols, you forget about what you should do. We go out on the streets, we start doing the gathering again, doing what we're doing, and before you know it, it spreads rapidly again. Sometimes with a more virulent strain, because mutation that takes place. And when that second wave comes, it's usually more aggressive.
Okay. One,
because people are weary, they're tired, they're not observing those protocols. Two, everybody, even in the health sector, they tend to be this, let us rest a little. This sigh of relief. And before you know it, it takes everybody by storm. So before you get your act together again to say, let us start, it spreads so much, and if you're not careful in the second wave, people tend to die more. That's what is happening in the US, that's what is happening in the UK and all of that. We are blessed in Africa that maybe because of the heat, because of tropical nature of Africa,
okay,
because of anti-malarials will be used to and things like that,
okay,
it's not hitting us as hard, but it's on a steady rise. It's on a steady rise, and that's why it is a wake-up call for everybody. If you've never believed it before, or you felt, oh, this second wave is just a sing-song, it's just a story being told for people to make money like they claim, hear this and hear it well. The second wave is real. The spread of the infection is on a steady rise, and people should please go back to the protocols that have been put in place.
Okay.
Simple as they are. Wear your face mask, avoid crowded places, social distancing, washing of your hands with soap and water, hand sanitizers and all that. As simple as they are, they help to break the transmission of this infection. For example, you go to the market, see where people are crowded, go to the banks, everybody has forgotten. You go to burials, you have over 1,000 people in a burial and all that. Some of these things. So we need to quickly make amends and let everybody be cautious. The first wave, the death was not more than 3%, nationwide.
Yeah.
But this second wave, the death rate seems to be a little more above that right now. Many people are dying now than they did in the first wave. So we need to quickly put those in check. And anybody who thinks there's no COVID-19, should better have a rethink. There is, infection is on the spread, but we can curtail it if we all put our hands on deck. That is the good news about it.
All right. How true is it that the coronavirus? The last one they had, we talked about the variants. Now there is this thing about a new variant that what we have now is worse than what we had before. How true is that? We have that in Nigeria.
Well, we've not done enough research to say if we have a new strain in Nigeria.
Okay.
But the research they've done, most of the statistics we're putting are the ones from either UK or America.
Okay.
They said they had a new strain. Normally, when you have things like this, there are mutant strains, mutation, just like you have malaria. And we're talking about resistant malaria. It's the same thing, just mutation. Okay. That strain has been around for a while, the drugs you use and all that. So it's just like Chinua Achebe said in his book, that since the hunter has learned to shoot without missing, the birds have learned to fly without perching. That's what is happening. The viruses kind of now find a way to avoid to survive the environment, so to speak. So you become slightly altered, slightly different from what you're used to. So the regular drugs may not be as effective anymore. So you now start looking for ways of getting. In the first wave, we used chloroquine, we used hydroxychloroquine, azithromycin and all, and they worked very well.
Okay.
But now I find that some of them are not working anymore. So we're not talking about new drugs like ivermectin, antiretrovirals, even trying out BCG. So many things have been tried to make sure we get an effective result, but it's work in progress. So there's a new strain we have not confirmed in Nigeria, but with the way people are not responding sometimes, it may allude to the fact that
in terms of symptoms, what's the presentation like? Is it like what you're used to before, like the first wave? Is it the same thing with patients? Are they presenting same symptoms, or it's a little bit different?
Well, even from the first wave, the presentation of COVID has been varied.
Okay.
The presentation of one person may not be the same in the other.
Okay.
One person may come with fever, loss of smell and taste,
Serious.
headache, persistent headache. That's just persistent headache and nothing else. Some may even come down with stroke. Bell's palsy, one part of the face is flaccid, or you have frank stroke. Person is hemiplegic. And we managed a 38-year-old man who had stroke. That was not the presentation. He didn't have fever.
And it was coronavirus.
And the test said it was positive. We managed him and he got better. He's gone home. He survived. We were doing physiotherapy while managing and all, and he got better and he went home. Some will present with just cough, difficulty in breathing, some with diarrhea. Now you see people, no fever, just diarrhea, persistent diarrhea that refuses to go. And you test them, they're positive. So the signs are varied. It could come in different shades, different forms. But if you fall ill and you're treating yourself for malaria or for whatever and you're not getting better, please get a test done.
Okay. Talking about treating the 38-year-old man, how would you rate the success of the FMC in handling COVID-19 patients so far?
Well, the FMC, like most other centers that were set up in the country, we did very well. At least the death rate was kept at 3% or less than 3%. Discharges were very high. Over 90% of patients were discharged, treated and discharged. That tells you the success rate was very good. In the first wave, we managed over 3,000 patients. We had a team in the States, we had two centers, FMC, the State Specialist Hospital, Warri Central Hospital, and Ogara. And all put together, we had a team, from both the state and federal that managed these patients. We had some that, the very severe ones, we admitted into the hospital, managed them, discharged and went home. While the mild to moderate ones, we managed at home, the home base. If you have a good, comfortable home, you can be isolated in your house, we manage you at home. And they all did very well. So if we could manage and get death rate of less than 3%, I think that was a huge success. So we did very well.
Okay, that's actually really encouraging. We do know that at a point in time, doctors complain about personal protective equipment not being enough. And there was also another news about 8 doctors being infected with coronavirus there at the medical center now. How true is this?
Okay, first of all, for the protective equipment, we in Delta State did not really have that problem.
Okay.
We didn't have it. Because aside from what we in FMC could provide, the ones we bought, the state government bought centrally and distributed to all the 4 treatment centers throughout the period of treatment. Even as I speak, they are still distributed, still giving to us to help in the management. And then in addition to that, donor agencies, a lot of them donated, and that helped the poor. So we in Delta State sincerely did not have that issue. We had enough. In the treatment center, we had enough protective equipment. Nobody went to the treatment center without properly kitted.
Okay.
And those items, is a single use. You go in, as you finish, you incinerate. So you can imagine the turnover, the rate of destruction. But even at that, we didn't have any complaints. And then the federal government had to also do a budget and intervention, the COVID intervention. And in that intervention, they provided money for us to buy protective equipment, which we have done, so we have enough in the store now. They also provided money for us to equip the isolation center. So for things we didn't have, maybe an ultrasound machine, an x-ray machine, a dialysis machine, whatever you didn't have, they provided money for us to buy and make sure we have all we need to manage the patients. Because when you come in, everything you need to do has to be done there. If you require surgery, it has to be done there. You cannot be taken to the main theater in the hospital. So everything has to be in that treatment center. And then also the government provided money for us to equip a 10-bed intensive care unit for the hospital. That is ongoing now. You come to the hospital, we are preparing our intensive care unit. In the next 6 months, 6 to 8 weeks, we'll be ready. The equipment for them are already arriving. So those are all part of the preparedness for this.
Okay, you talked earlier about hydrochloroquine and other drugs that we administered to patients in terms of getting them cured of COVID-19. What's your take about the vaccine that is said to be released in treating COVID-19 patients?
Okay, thank you. So before I take that, let me just comment on the 8 patients that tested positive. You know, we now do testing at the Federal Medical Center. In the first wave, we just had a central place at the Asaba Specialist Hospital where all the testing in the state was being done.
Okay.
But now, with the intervention of NCDC, we have upscaled our GNS machine and we can test in FMC now. So when we started testing and started rolling out results, the first 8 tests that came out, or the first batch of tests that results that came out, 8 patients tested positive.
Okay.
Among them were 4 of our doctors. 8 patients on the whole, 4 of our doctors. You know, they've been having symptoms and all that, and so
were they isolated, or you just
well, isolated. Once you have symptoms and test positive, we isolate you.
at home? You do that at home, or
if your symptoms are moderate to severe, we admit you in this facility and treat you. You have nothing to lose. Everything is provided.
Okay.
It's free of charge. So we bring you in and we treat you. So we took them in and we treated them. They're fine now. They're back to work. From the
How
first
long did it
week,
take to do that?
about 10 to 14 days. Within 10 to 14 days, they test again, their negative symptoms are gone. And then they just rest for another 2-3 days.
Are doctors often tested around the hospital?
Yes, we sometimes do random sampling. But what we do now is, once you complain of any symptom or you manage a patient that tested positive, we must isolate you and test you.
Okay.
For example, in our emergency, we manage 2 patients that turned out to be positive. You know, the patients will come in with different symptoms. They may come in with heart failure, come in with, what will I call it, acute abdomen, no fever, no typical symptom of COVID. So you're managing for heart failure, you're managing for diabetes, controlling blood sugar. While on admission, the patient just suddenly have a spike of temperature, you know, start coughing or something. The symptoms are changed, you know, screen this patient, and it turns out positive. So mainly happens, you move your patient to the isolation treatment center, and then you screen all those who have been managing that patient, and you decontaminate that place. So our emergency was shut down for 48 hours when that happened. We moved out all the patients, moved all the staff away, and we decontaminated for 48 hours before we opened again.
Now I'm actually thinking, since symptom presentation is actually unique. For one person is another, and another person is a different thing altogether. And sometimes the symptoms are similar with other ailments. Don't you think it's appropriate now that we have a new spike to have a compulsory COVID-19 test? If a patient comes in, all patient that comes in, there should be like a quick test for their COVID-19 to rule that out before you do treatment. Don't you think it's a good measure to start to manage the second wave of the pandemic?
What if we had to do that, we may not have the capacity to cope.
Why?
Imagine a hospital where you have over 2 to 2,500 people visiting every day. In the clinic, you have maybe 1,000 people, 1,500. If you have to screen everybody and get the result before you see them, there'll be chaos.
How long does it take to get the result?
You know, the result takes about...
a quick rapid test, the quick test.
No, it may not be too reliable.
Okay.
We do the PCR and the GNS part, that may not be too reliable. So what we do now takes at least 3 hours to come out. So if you have to do that before you get seen, there will be confusion in the clinic. You have real problem. But what you do is, you carefully select your patients. If you're in the clinic and you're seeing a patient, and you see from the symptoms, of course, there's a distance, you're seeing the patient, you're also protecting yourself, your face mask, your hand gloves, and all of that. And then the patient, from the symptom, you notice that this patient can be suspicious. You tell them to pick the sample and screen. So you are doing selective screening. You cannot screen everybody, or else the system will not run. And if you bring critically ill patient and you say, oh, this patient must be screened before I see, the patient will be dead before the result is out. So you need to strike a balance. That's what we're doing.
Save lives. Okay, let's talk about that vaccine that has been released.
Well, the vaccine has been released in the UK, in America, and they're using it. It's a messenger RNA vaccine. We haven't gotten. The country has applied to get some. It hasn't come. When it comes, our scientists will need to still look at it, do more trials on it, and be sure it is safe enough before we administer it. But the primary healthcare agency of Nigeria is handling that, and they've given a distribution pattern based on some criteria, maybe prevalence and population and all that. But I think when it comes, our own scientists, NCDC, NAFDAC and all that, they'll do some clinical trials, and once it's certified that it's good enough, it will roll out.
Now, what's your position on having having the country Nigeria, produce a vaccine, having a locally made vaccine? Now, I do know that 20 billion naira has been set aside, for vaccine to be produced locally. Do you think Nigeria has the capacity to produce vaccine locally, or would there be like a partnership with other institutions that are into it?
Well, Nigeria has the capacity. What we need is the right funding, the right motivation, the right environment, and we can do that. I'll give you an example. Yes, the gene sequencing that was done when COVID started, the first one, that matched with the Wuhan strain, was done at the Yaba Research Center.
Oh.
And that was the same result I was getting in UK, and it was same. So if you have the right equipment, you have the right motivation, right environment, and the right funding, why not? We are very brilliant researchers in Nigeria. In fact, you go abroad, America, UK, most of the people you see in those research centers and in their hospitals, they're Nigerians. Quite a lot of them are Nigerians. They left this country because they felt, yes, they were not getting the support to practice the way they wanted to practice. But if we get that right encouragement, right environment here, why not? We can produce vaccines in Nigeria. It takes a very rigorous process to produce a vaccine. Very rigorous. So it requires the right environment and people being very meticulous.
Okay.
We have to go through a lot of trials. Sometimes the vaccine may take 4 years. The controversy surrounding this one is because the duration was too short.
Yes.
So people felt they've not done enough thorough job because they've not gone through enough trials. That's why there's this skepticism about this vaccine. If not, vaccine production takes a long time. Sometimes 10 years, sometimes 4 years of serious research. Ensure this thing is safe enough that when you roll it out, it's not going to create another problem for you, or it's not going to infect you what you're trying to avoid. Because what the vaccines are just inactivated viruses or inactivated bacteria that you're trying to guide against. So you must be sure that when we give this inactivated, we're not creating that disease in you. We're only invoking a response for your body to build immunity, but we're not creating that disease or creating a problem for you. So there's lots of stages it has to go through. Okay, but we can do it in Nigeria if we have the right support.
Okay, Doc. Now this is we are faced with another wave as a new spike. I wanted to speak to lifestyle, what one should do. A lot of people are taking drugs. They're taking vitamin D. Without even prescription, they're taking loads of 1,000 milligram vitamin C and a whole lot. So now I want you to speak to lifestyle, medication, vitamins, how to build your immune system, and what you should do normally as we try to manage this the second wave of the pandemic.
Well, for every Nigerian who wants to stay alive, there are things you can do to help yourself. Exercise is one. Exercise as often as you can, 3-4 times a week. Very important. Exercise. You're trying to build your body, build your immunity. Okay. Exercise is one. Eat the right food. Eat well. Your food, eating right and eating well, helps you build a good immunity. When your immunity is good, it helps you fight infection. So,
when we talk about right food, what are we looking at?
Your balanced meal, we'll talk about it. Take your balanced meal, the right proportion of your protein, carbohydrates, fat and all that. Fruits. It's not the quantity, but the right proportion, a balanced meal. Fruits are very good. Okay. Fruits to support you. Vitamins to support your system.
What kind of vitamins are we looking at?
Vitamin C is very good. Vitamin D is good. But you see, don't take them without a prescription. Because some people take an overdose and it becomes a problem. During the first wave, because they say, chloroquine can treat you, somebody went and put all his family, his children, everybody on chloroquine every day, take 2 tablets, and they were done it for over a month.
Wonderful.
And one of them came down with liver failure.
Jesus.
So there are dangers in this. Drugs, every drug you take, just as your food, an overdose of it is bad. And drugs have side effects as well. So as you take them, you get a point where you trigger the side effects when you're taking more than you require. So make sure you have a prescription to take that.
Okay.
It will help you. And then secondly, self-medication, we need to be careful with self-medication. It's not enough to say, oh, I just read, on the social media, a lot of posts are going on. Oh, ivermectin, take it.
Dr. Media.
Some are even giving prescription. This is the dose how you should take it. And they tell you, oh, it's vitamin D. Take vitamin D. Take zinc. Take this, take that. Be careful. Be careful. If you must
And
take
we have
them,
fake drugs even in circulation.
yes, if you must take them, why don't you seek an advice? It doesn't take anything to walk into a hospital. At the best, get a card, maybe 500 naira or so, and get it. Just consult with the doctor and advise on what to do, and that's all. And you go. Instead of you just resorting to self-medication and taking whatever they think, whatever anybody says works. You are drinking the local herbs. You are drinking gin. You are drinking. So we need to be careful. We need to be guided.
Okay, now what's the present condition of isolation centers at the Federal Medical Center? What is it like at the moment?
Well, we have an isolation treatment center. It has a 10-bed capacity for treatment and 2 beds for holding. And right now it's full.
Okay.
It's full to capacity.
It's full.
It's full. Yes, it's full. We can't even admit anybody now unless we discharge. It's full.
So if someone has COVID-19, now what would the person be? You tell the person to go home for
Self-isolation.
If you have mild symptom, we can manage you at home, self-isolation. If you have very severe symptoms, you are desaturated, and we need to admit you.
How will you manage the person at home?
We'll counsel you, give you your drugs, and they call you every day to find out how you're doing. And if you're deteriorating, we'll bring you in. So that's the way it is. Yes.
Okay. Recently, schools resumed, and there was a little debate between the members of the House of Representatives and then the executive, which insisted that schools should resume, which happened on Monday. Now, as a man in the field of medical practice, what would be your advice? Is it okay that schools resumed on Monday?
Especially for primary, nursery, creche, as against tertiary.
Well, we cannot keep our system on hold in perpetuity. That is the truth. We for the foreign, for the advanced countries, Europe, Canada, and America, they had the means to do a lockdown and you keep people at home. Where a family or an adult gets about, say, $600 a day, you get food delivered to your doorstep and all of that.
Okay, that's true.
We may not be able to do that in Nigeria. And a lot of our people live on a daily income. It's difficult tying everybody in the house. So with the prevalence of what we have, my opinion, we may not need to have a lockdown.
Okay.
All we need is we need to be disciplined and responsible citizens. If we observe the protocols and we show up when we should, and we're getting the support we're getting now,
Do you think
this economy can still run. The kids have gone back to school.
Can they comfort themselves and
comfort
discipline?
themselves.
But you see, for children, especially those
They
in
can try their masks together.
secondary, primary school, you cannot stop them from aggregating all that. But thankfully, the severity in children is not that much. Even when they test positive, most times they don't have symptoms.
Okay.
Most times they don't have symptoms. So they have this immunity. God has protected them. And most children, I can't remember us losing any child throughout that first wave. Any child that comes up, most times they are asymptomatic. So I think the schools can go on. For the universities, that's where I think the challenge is. We can do, before they go in, we can screen all of them. Anybody is positive, you treat them before they go in. But keeping them at home, we don't know how long this is. I'm envisaging a situation where we may have this COVID become like Lassa fever, become like malaria, become like HIV. In the midst of COVID, we're having Lassa fever steadily. Once in a while, you just pick up a patient, Lassa. We isolate them, we manage, they go. We'll follow up on the family and all that, and you forget about it. We didn't want to have another one.
All of these doctors are the forefront. How safe or protected are doctors, in the fight against COVID-19?
Well, you cannot say they are 100% safe. We try as much as we can to give them protective materials to work with.
Okay.
But sometimes you find that in the course of saving lives, you go the extra mile. Either body fluids will spill on you or one thing or the other, and some of them get exposed. So the only thing to do is from time to time we test them, and once anybody shows symptom, we immediately make sure he gets the care he needs.
How do you manage your personnel?
You really cannot, if you say you want to be very careful, it means you don't want to see anybody, you want to work anymore. So you really cannot be too careful.
Too careful.
How did you manage your personnel on a light note and on a personal note? How do you manage your personnel, especially the young doctors during this period, to motivate them despite the fears? Because we heard stories about doctors being concerned about their own safety and being a little bit hesitant in treating patients.
What we have done, first of all, we had trainings for them. Trainings, make sure you are equipped with the right information. That's one. Two, we provided protective materials. Like I said, the state government supported us, federal government has given us money to also buy protective materials. So we make sure we have enough, not only for the treatment centers, but for those who are working in other departments, because you are exposed as well. I can be in emergency, patients are brought in, they've not been tested, I don't know whether they're positive or not. So we'll try to provide face masks for them, KN95, that's what the health workers should use, and then gloves. And then for some, going to manage highly suspicious cases, you have the Hatman suit, which you can put on. So we make sure these are available for them, and then provide hand sanitizers, provide enough, make sure that you have running water, basic hygiene, make sure it is put in place. That's about what you can do. There's nothing more. You can't tell them to stop work. Motivation.
Doctor, isn't this too extreme? Like she has the gloves, she has the glass on, and then isn't it too extreme for her to do all this in terms of trying to protect herself from coronavirus?
It's not extreme. This is what we do in the treatment center. You have to wear this Hatman suit.
For doctors?
Yes, for everybody in the treatment center. Both cleaner,
cleaner,
everybody that works there, going in there.
I'm coming to work, I wear my gloves.
You're not a risk. You don't work there, so you can't do that. But for those who work in the treatment center, that's
what they should do.
That's the way we dress before you see a patient. Okay. Because those patients are confirmed, so you must protect yourself adequate from head to toe. Some will even put your hood and everything. You have a boot on. Make sure every inch of your body is covered before you go. Make sure you don't catch it. But for those in the emergency or other departments, we don't dress this way. You scare the patient.
I'm telling you.
And it's not comfortable. It's very hot. It's not comfortable. That thing is not comfortable.
There's a myth with gloves. There's a myth with gloves, doctor. Yeah. Some say that with gloves, if you wear your gloves and then you leave it for some time, that is not very safe as well. Chances are, some of you'd sweat. And by the time you take it off, you must have touched one or two things, and then you can still have it, on your skin. They said it's not too safe to use the gloves all the time.
No.
That hand sanitizer is preferable.
You can't just put hand sanitizer and go and see a patient who is suspected to have it. So you need to wear gloves. That's the safest thing. Okay. Wear gloves. So you take them out. You wash with soap and water, and then apply your hand sanitizer.
No, I know that's a medical. I'm talking about individuals like us that were not in the medical field.
Okay.
That's what I'm talking about. Is it okay to go? When this started, I was always using gloves, and I read an article and they're like, please don't use gloves. It's not safe, because you're not in the medical field.
And you're not professional.
And you just wear it, and then you go wear it again. You don't know. It sticks. You have a lot of it sticking to it, and it's not very okay.
You don't need to wear it if you're not a medical person. Just wash your hands very well. Use your hand sanitizer. You don't need to wear gloves.
Let's talk about patients.
As we're running off. Yes.
Patients in the hospital. Okay. I've been to FMC, and sometimes I've seen loads of patients coming in, especially this period where lockdown has been eased and people move around. People move around in hospitals too. How effective has there been laws to ensure that there is social distance and patients don't just cluster on each other? Just before we go.
Okay, what we've done in FMC is, in the clinics we try to do spacing. If you have a 3-seater, make sure only 2 people sit there. The third space, the middle space is left unoccupied, that's one. 2, we make sure we spaced out the clinic days, your visiting, your appointments. For example, the elderly, those who are 60 and above, we make sure we give them long appointments. If you are coming to the hypertension clinic or the diabetic clinic, instead of your normal 4 weeks visiting or 2 weeks, we may give you 6 to 8 weeks. And if you have complaints, call in. We can talk to you on phone. So we make sure we don't have the place crowded. So we'll try to reduce the number of patients in the hospital. In the wards, we have reduced the number of beds to ensure social distancing. In a ward of 20 beds, we have reduced to maybe 12 or 14. you remove the beds in between to make sure you have enough.
All right, thank you very much, Doc, for your time and of course telling us so much about coronavirus outbreak, the previous one and the one we are about, the one that we're in at the second spike. We appreciate your time and would want you to call in again to tell us more about the coronavirus update. Would like you to avail us your time as well. We appreciate you for coming. We've been interacting with Dr. Osiatuma Victor Azubuike, the Medical Director of Federal Medical Center, FMC, Asaba, talking so much about coronavirus pandemic, what you should do, and the management here in Delta State. To stay with us, about time to bring you national stories as we'll take our deals. We'll be back in a moment. We appreciate you for coming again.
Thank you so much. It might be my pleasure.
Thank you very much.
Thank you.